And now for a message from our sponsor, the Hartford. Please welcome Lori Goldterman, CEO of Aon's U.S. Commercial Risk and Health Business, and Chris Swift, Chairman and CEO of the Hartford.
Hi, I'm Lori Goldterman, CEO of Aon's U.S. Commercial Risk and Health Business, and I'm really pleased today to be speaking with a colleague and a friend, Chris Swift, who's the Chairman and CEO of the Hartford. Thanks for sponsoring the conversation today, Chris. I know at Hartford, you're a strong advocate for mental health and the stigma of addiction, which we are all facing today, a rise in both related to the pandemic.
Thank you, Lori, and it's great to be with you, and thank you so much for sharing the stage today. As you know, the Hartford is a leading workers' comp and disability insurer, and we like to say we're in the business of underwriting human achievement, helping thousands of U.S. workers each year return to active, productive lives after an injury or an illness. And we know from many decades of our experience that untreated mental health conditions and addictions prevent many Americans from living full, healthy lives. And over the past 14 months, there has been a startling increase in addiction and mental health challenges, principally due to the environment that we were living, where there was significant loss of life, social isolation, economic hardships, and the racial inequality that came to the forefront. So as we sit here today, Lori, I'm proud to say that we've partnered with NAMI, the National Alliance on Mental Illness, and really they call it an epidemic within a pandemic. And we also know from our own research that we announced today that more working Americans are dealing with mental health challenges such as anxiety and depression than ever more in the past. And we're here ultimately to shine a light on this and talk about it. So again, thank you for joining us today.
Well, and it's been an unbelievable past year and a half. I mean, I don't think any of us could look back and have thought we would go through all the different hurdles that we faced. Our families we've been apart from for so long. Many of us are missing that work environment with our colleagues' interaction. And even though the two of us have been on airplanes a lot, this working from home, I think we've never worked with more intensity or such long hours. These are truly unprecedented, challenging times, Chris.
Yeah, completely agree. And I would say, many employers are reporting increased stress and anxiety over the past year, and with all their employee base, no matter what part of the country you're in, whether you're working at home or you're working in the office, it has been a very stressful and anxiety-based period of time. In fact, 70% of employers that we polled say that they do now recognize that their employees are suffering with significant mental health challenges, and it's becoming more of a workplace issue. Also, 52% of those employers said that they're experiencing a significant or severe workplace issue due to substance misuse or addiction amongst their employees. So these are real life conditions that we face today, Lori.
It's just incredible the numbers that you've cited. I would say mental health is the number one conversation our corporate employers are wanting to have a conversation. And your statistic in your report, mental health is among the top 5 reasons for U.S. workers to file a short-term disability claim. And 72% of employers say stigma prevents treatment. So when you think about, this is something that if we can change the culture around the word stigma, people are afraid to bring it forward. And this is where I think we can make such a difference. I'd be curious, your thoughts on just how we can start to drive this change and how stigma impacts that.
Sure. Well, as I said, we have one great partner in NAMI. We also have another great partner in Shatterproof, who's also a Connecticut-based organization really focused on the opioid addiction and really preventing it. And both of those organizations talk about the power of stigma in not enabling people to get the treatment that they need. So again, it's a real workplace issue. It's a real home issue to really destigmatize both addiction and mental health. And there are real costs associated with mental health. In fact, NAMI estimates that untreated mental health illness here in the U.S. costs the U.S. economy about $300 billion annually due to lost productivity, absenteeism, turnover, and increases in medical and disability, costs. In our own research, 1/3 of U.S. employers say that strain on workforce mental health is, having a severe or significant financial impact on their company. So it's a real, business issue. It's a real, health issue also, Lori.
And the dollar amount, 300 billion, is staggering. And I think, we all have probably benefit plans that have that employee assistance program, but this past year, those were explosive. In fact, in many cases, when you needed to get those services, it was really hard to find the capacity of enough people to help those dealing with mental health illness or addiction. And you start to think about, is there a business case here to tackle this stigma and to encourage treatment? Should employers really take this on, not just for the good of their employees' health, but the business case around this issue is significant?
Well, I think you're absolutely right. Reducing stigma in the workplace is paramount to improving the lives of Americans and our employees, right? This is a workforce issue. It's a productivity issue, and there's a business case to be made for making investments in programs, to generate that return on an investment, which ultimately, translates into higher sales, stronger margins, lower absenteeism. So I'm urging all business leaders, across the nation to continue to prioritize Americans' mental health by fostering a stigma-free culture that removes hurdles of stigma for those needing treatment, and allowing them to more easily seek that treatment, have the confidence to seek the treatment, to get on the journey of returning to health and productivity, because it is going to take time. These issues are not a quick fix, and we need to be encouraging as business leaders.
Well, the only way to move the needle is to bring those public health leaders and policy makers together. And the insights today have really been helpful, I think, to this conversation. There's no question. And why do you think, Chris, it is important to engage the public policy on topics that we're discussing today?
Well, I think we've got good history lessons here. When public and private sectors come together to work on solution, magic really happens. I could point to the opioid addiction issues that we've been very vocal on over the last 5, 6, 7 years. And again, the private sector, public sector came together to really reduce addiction and destigmatize a lot of the language associated with that. So I think the realistic issue is a lot of these matters aren't partisan issues, which is good these days when something's not partisan to make progress. And we met with both lawmakers on both sides of the aisle, and I think there's a great sense of urgency to get after some of the mental health conditions that we face today. Prior administrations have supported mental health with funding. I suspect this current administration will also look to increase funding and ultimately treatment for people going forward. So I think that's the power of the private and the public sector coming together, and all parties could contribute to doing good. I would just say in wrapping up, Lori, though, that we're also heartened by another finding in our survey that the majority of employers and U.S. workers think that mental health will become less stigmatized in the workplace as a result of the pandemic. It's actually freeing up in more discussion. So we hope this is true. We're encouraging it in our own actions as an organization, and that will be powerful in and by itself. So we know how
that's where it starts. That culture of stigma-free environment, and Hartford is such an amazing leader in workers' comp and disability, and you're such a strong leader in our industry. I'm proud to be part of Hartford study in promoting mental health and a stigma-free culture. So thank you.
Well, the feelings are very much mutual. I known you many, many years. I have a high degree of respect for your firm and the advice that you do provide to your clients in these areas as a health provider, as a benefits provider. So my hat's off to you to continue to do the good work in helping all Americans return to mental health.
Thanks so much.